If you've tried PRP for hip pain and maybe it helped a little bit or it didn't help at all, or if you're considering PRP and you're just not fully convinced or you're unsure, this is going to be important for you to understand. Hi, I'm Dr. Jessica Warnicki, orthopedic and pelvic floor physical therapist, and I specialize in helping active women overcome chronic hip pain, especially when rehab, injections, maybe even surgery haven't fully helped. For PRP, I think it's important to understand what it does, what it can help with, and maybe where the gap lies, especially with chronic hip pain and especially if you're an active person. So PRP helps with tissue healing, taking platelets out of one's blood, injecting it into the tissue site to help with tissue healing because of the growth factors that are present, reducing inflammation, helping with collagen. There's a number of good things that can come out of PRP. However, when we're dealing with something like hip pain, especially if it's been chronic, there is an underlying limitation that isn't purely tissue focused. It could be compensation patterns. It could be stemming from dysfunctions in other areas of the body, like the pelvic floor or the feet or breathing patterns. There's also a nervous system component. So what is our brain used to? If our brain is used to having pain or used to compensating or modifying or avoiding, eventually those become our new normal. Those patterns become our consistent go-to. And those aspects that feed into hip pain aren't going to be addressed by something like PRP or other injections. Now, PRP may be very helpful for some people or certain cases. However, when you're feeling like your symptoms keep coming back, you rest a little bit or you have the injections and you feel good for a while, but as soon as you try to do a little bit more or a certain amount of time goes by and your symptoms return, that's telling us that there's more involved than just the tissue feeding into your pain. Or maybe you're somebody that feels really strong. You've done a lot of rehab, you've gotten stronger, you've made progress there, but your pain hasn't fully resolved, or your pain tends to be cyclical. It can be affected by stress or environment or hormones in your cycle. Those aspects are going to tell us that there's more to this pain pattern than the tissue itself. And we have to look at everything comprehensively in order for us to fully understand what are the biggest driving triggers for your pain and what all can we do or what can we teach your body to learn so that we can start to reduce the triggers themselves, but also create a sense of security, trust, and structure for the body to build on to create a new normal and not just to create a stronger compensated normal for your body. A lot of the things that we will look at and work on with women is, first of all, understanding their pelvic floor. This is not just Kegels. This is not just breathing or stretching. This is how is the motor control? What's the brain and the pelvic floor awareness? Can the brain actually activate and feel the pelvic floor? If so, can it use those muscles with the rest of the hip structure, with the movement patterns, with the strength training so that the body is working together completely from the inside out, having a solid foundation? Or is there a disconnect somewhere? Oftentimes there is. And that can be due to a number of different factors. It could be because of a specific injury or event, a fall, a fracture, pregnancy, delivery. It could be due to things like stress, whether it's a long-term stressor that's been going on or a recent change, whether it's good versus bad stressed. It can also be associated with just our characteristics or personality traits, right? If we're high achieving, go, type A, perfectionist types of women, if we're people pleasers, right? Or if we're filling everybody else's cup up first before ourselves, the pelvic floor is the place in the body that holds onto this. So we have to look at a lot of these aspects. And then we also have to look at the movement. From the feet up, from the head down, the hip does not work in isolation. If we have labral tears or impingement or tendinopathies, those are signifying that there's some form of movement coordination limitation. And we have to look at everything and teach the body how to work well together again in order to remove that trigger that might be driving into that pain point, whether it's the tissue damage, whether it's a tightness or a weakness or something like an actual labral tear or tendinopathy. We have to make sure that we're not just trying to treat or heal the issue in isolation, but we're looking at it and understanding it completely. Lastly, another huge thing that we look at and we have to understand is the neuroplastic aspect of what goes on when we've had a recurring injury or a chronic type of pain. The brain controls a lot of things. The brain is what interprets the pain itself. The brain is what learns from past experience in order to essentially try to prevent future pain or injury or discomfort, because the brain doesn't like that. However, when we've been in this chronic cycle over and over and over again, eventually the brain gets used to those patterns, and the brain doesn't understand that now this is a dysfunction and it's no longer interpreting signals correctly. So it becomes more and more on guard. It becomes more and more aware or in anticipation of a fear, a movement, a pain trigger, a scenario, or an environment. So many different things can feed into that brain interpretation that then feeds physically into the guarding, the tensing, the holding on to safety, a sense of safety within the body so that we can try to prevent feeling the pain again. When we have these patterns over and over again, they all start to feed into one another. So what the brain thinks or anticipates is where the pelvic floor holds on. And when the pelvic floor is maybe a little guarded or tight, it's not going to stabilize or allow the movement to come comfortably through the hip. Or it's going to put more strain on other areas like the TFL, the hip flexors, the knee pain, right? The low back. It's going to expand because essentially it's trying to figure out how to get the job accomplished, but it doesn't have all the players showing up to play on the same team. So again, the PRP can help, injections can help, but only if there's a little bit of that tissue damage present, and only if we're looking at all of these other factors and addressing them comprehensively, so that we're not just trying to out-exercise something or out-inject something. We're actually understanding what is keeping that something present in order to be able to give the body the right tools, teach it the right skill sets to start to reduce the triggers themselves, reduce the response, and rewire a brand new normal from a movement standpoint, the brain and plastic standpoint, as well as from a confidence standpoint. Now, this can look different for different people depending on what's truly driving the triggers or keeping them stuck in the pain pattern itself. But this is what we do with a lot of the women we work with. We have to look at everything. And this is where I hope if people are going to experience injections or do PRP, great. Do what you and your providers feel are best. And also make sure that it's not just being given to you in isolation. Make sure there's other things that are also being addressed and looked at comprehensively so that we're not just doing this treatment, or this treatment, and we see how they each independently work. We have somebody that understands the full picture and is able to put those pieces together in a way that makes sense for the body. If you're trying to figure out what's really driving your recurring hip pain and you've tried a lot of things and maybe they've helped a little bit, but they haven't fully resolved your limitations and your pain, clarity is going to be our first step. We need to understand how it's all connected and what is truly keeping you stuck so that we can start with the right first step and then be able to build from that. If you're interested in learning a little bit more about what this may look like or what this process could entail, we have a free training, our Healthy Hips Formula training, which will give you a little bit more insight into my own experience with my chronic hip pain journey, as well as what we've developed and what we've tested over a number of years with hundreds of active women, and why some of the things that a lot of us try aren't the full picture. They can be very helpful, but what can it look like to put all of these pieces together, and where can we start on the road to clarity, but also on the road to full resolution so that we can prevent this from coming back?